Good afternoon. I am Dr. Sarita Aggarwal, Professor and Head of Department of Ophthalmology, Santosh Medical College. So today I will be taking cornea. So as you all know, there are three layers of eyeball. Outermost is fibrous layer, that is sclera, and the anterior part of the sclera or anterior part of the eyeball is made up of cornea. Middle layer, middle layer is uveal tissue layer, and innermost layer is the retina layer. So just talking about the anatomy of cornea, as you all know, cornea is a transparent structure. It is avascular. It constitutes anterior 1/6 of the eyeball. It is convex forward and elliptical in shape. Horizontal diameter is slightly more than the vertical diameter, and thickness is more in periphery than in the center. It is an important refractive surface of the eye, and the refractive power of the cornea is plus 40 diopters, and refractive index of the cornea is 1.34. Coming to anatomical dimensions of normal cornea, horizontal diameter of anterior surface is 11.7 millimeters, vertical diameter is 10.6 millimeters, and radius of curvature of anterior surface is 7.8 millimeters. Posterior surface corneal diameter, horizontal it is 11.7 again, vertical diameter is 11.7, and the radius of curvature is 6.5. Centrally, the thickness of the cornea is 0.5 to 0.6 millimeter, and peripheral thickness is 1.2 millimeters. Coming to the corneal layers, so there are 6 layers of the cornea: epithelium, Bowman's layer, stroma, Duar's layer, Descemet's layer, and endothelium. And how you can remember all these layers? Just learn A, B, C, D, E. A means epithelium, B means Bowman's layer, C means stroma, D means Duar's layer, again D means Descemet's layer, and endothelium. So coming one by one on these layers, so from anterior to posterior, first is epithelium, second is Bowman's membrane, third is stroma, that is the thickest layer of the cornea, then is the Duar's layer, fifth one is the Descemet's layer, and the endothelium layer. Coming to epithelium, it is 5 to 6 layers thick. It is continuous with conjunctival epithelium, and once it is traumatized, it always regenerates. Second is the Bowman's layer, and what are the properties of the Bowman's layer? It is acellular structure, and it doesn't regenerate once it is eroded. So, if suppose trauma occurs in Bowman's layer, that means there will be opacity left in the cornea. Third is a stroma, that is the thickest layer of the cornea. It constitutes 90% of the corneal thickness, and it is composed of collagen fibrils. These are arranged as lamellae lying parallel to the surface, and it never regenerates once it is eroded. Fourth one is the Duar's layer. It is also known as pre-Descemet's layer. It is composed of collagen, and it is a very strong and impervious to air. Next is the Descemet's layer. It is very much resistant to the inflammation, and after injury it readily regenerates. And last one, that is the innermost layer, that is the endothelium layer. It consists of single layer of hexagonal cells. It never regenerates, and with advancing age, number of endothelial cells decreases. And the cells of endothelium, it is examined by specular microscopy. And the average cell count of endothelial cells is 2800 cells per square millimeters. In children, it is about 3500 cells per square millimeters, and in old age, it is about 2000 cells per square millimeter. Thus, if the number of cells decreases less than 2000, that means there will be opacity developed in the cornea. Coming to the blood supply of the cornea, so the normal healthy cornea is avascular. That is the reason for its transparency. Corneal cells derived its nutrition by diffusion from aqueous capillaries at limbus and oxygen dissolved in tear film. Coming to the nerve supply of the cornea, it is supplied by long and short ciliary nerves from ophthalmic division of trigeminal nerve. Most are concentrated in anterior stroma beneath the Bowman's zone and sends branches forward to the epithelium. And due to the dense nerve supply, cornea is extremely sensitive structure. So whenever any trauma occurs in the cornea, whether there is ulcer in the cornea or there is foreign body in the cornea, so those conditions are very, very painful due to its extreme nerve supply. Functions of the cornea, the first foremost function, important function of the cornea is optical. It forms principal refractive surface accounting for approximately 70% of the total refractive power. So the total refractive power of the eye is 60 diopters, out of which 40 diopters is contributed by cornea and rest 20 diopters is contributed by lens. It maintains the structural integrity of the globe. It protects the eye from UV irradiations and it allows transmission of the light by its transparency. Coming to the very important question usually asked in the exams, why cornea is transparent. So there are two factors, those are responsible for the corneal transparency. First is the anatomical factors and second is the physiological factors. So what are the anatomical factors? Uniform and regular arrangement of the corneal epithelium. Number 2, peculiar arrangement of the corneal stromal lamellis, corneal avascularity and precorneal tear film. And among the physiological factors, due to its relative state of dehydration, the cornea is transparent. So any process which upsets the anatomy or physiology of the cornea will cause loss of transparency to some degrees. So taking one by one factors responsible for corneal transparency, first is corneal epithelium. So epithelium is transparent due to homogeneity of its refractive index, due to the tight intercellular junction and due to the resistance to flow of water, electrolytes and glucose. Second factor is due to the arrangement of stromal lamellis. So there are various theories why cornea is transparent due to stromal lamellis. So one such theory is Morris theory and second is the theory of Goldman's et al. So what Morris theory says, corneal transparency is because of the uniform collagen fibrils which are arranged in a regular lattice so that the scattered light is destroyed by the mutual interference. And the loss of transparency will result if this regular arrangement is altered by stromal edema or mechanical stress. And according to the Goldman's theory, lattice arrangement is not a necessary condition for stromal transparency. Rather, he postulated that the cornea is transparent because the fibrils are small in relationship to the light and they don't interfere with light transmission unless these are larger than 1/2 a wavelength of light. Third factor is the corneal avascularity. Cornea is avascular except for the smaller loops which invades the periphery for about 1 millimeters. And in cases of progressive vascularization, transparency again hampers. Fourth factor is precorneal tear film. Tear film plays a very important role in maintaining the transparency and conditions associated with the tear film abnormalities may result in the loss of corneal transparency. So the state of dehydration is maintained by the integrity of hydrophobic epithelium and endothelium pump, osmotic gradient, and the main role of endothelial cells is to limit the fluid intake of cornea from the aqueous. So this is the reason why cornea is transparent and this is all about the corneal anatomy. Thank you. So the next topic I will take inflammation of the cornea, that is also known as keratitis. So the inflammations could be superficial or deep. Among the superficial, it could be infective, it could be non-infective. And among the infective, it could be bacterial infection, it could be viral infection, it could be acanthamoeba or it could be fungal. And among the non-infective, it could be central, that is known as the exposure keratitis, and it could be peripheral, that is known as the marginal keratitis. And in the deep keratitis, it could be interstitial, disciform and sclerosing keratitis. Now coming to the keratitis, there are few terms actually related to keratitis. First is superficial keratitis. Superficial means the inflammation is anterior to the Bowman's layer. Superficial punctate keratitis means the inflammation is there in the dot form or the punctate lesions. Deep keratitis means the inflammation is there in the stroma. Now there are two terms again. There is epithelial defect or corneal abrasions or corneal ulcers. So what are these terms which are applied to cornea? So what is epithelial defect? Epithelial defect means loss of epithelium. It can be demonstrated by fluorescent dye and viewed with cobalt blue filter light. Corneal abrasion or erosion means there is loss of epithelium without any inflammation of the neighboring layers. What is corneal ulcer? Loss of epithelium along with inflammation of the surrounding area. So this is the basic difference between ulcer and inflammation. Thank you.